President, I move that this House supports the motion in my name. Notes the tabling in Victoria of John Ryan's independent review into the operation of the North Richmond Medically Supervised Injecting Room and his report's conclusions that A, up to 63 lives have been saved during the trial period, and B, that the facility should now operate on a permanent basis. B, notes and welcomes Labour's acceptance that, as set out in its 2019 policy platform, that drug and alcohol policy should be based on evidence of what works and what does not. And C, calls upon the McGowan government to review the drug injecting room evidence from Victoria and to report back to Parliament within the next 12 months on the potential to roll out a similar programme here in Western Australia.
Members, the Honourable Brian Walker has moved that motion, and the question is the motion be agreed. The Honourable Brian Walker.
When it comes to medically supervised injecting rooms, I want to stress at the very outset that I have seen the damage that illicit injectable drugs can do in our community. I have seen the death, I've seen the destruction, I've seen the evils that abuse of drugs can cause to the individual, to the children, to family members, and indeed society in general. I am absolutely against all abuse of drugs, and in no way am I encouraging their use. I'm sure I have the support of all members in this chamber. But it's also an incontrovertible fact that people do abuse drugs and will continue to do so. Another incontrovertible fact is that people do now and will continue to use drugs intravenously. Prohibition has not stopped that, nor will it. People die. The highest rate of drug-induced deaths was observed in Western Australia for the third consecutive year. 9.9 deaths per 100,000 people. That's shocking, members. And worse than that, those 3 consecutive years seem to suggest we're not having a great deal of success in tackling the problem. We're already behind our neighbouring states and territories, and my fear is that if we don't learn the lessons they can teach us, lessons like the establishment of the medically supervised injecting room, either full-time or as a trial, we're going to fall further behind. Is there any reason why we in Western Australia would not want to see that sort of service rolled out here in Perth, when the evidence is there to show that it works? But the truth is, it improves and saves lives, and also the quality of life, which should be our primary concern, saving life. It gets people in to see the doctors, it keeps them out of the emergency department, and it improves health outcomes across the board. We need to have clear local data on overdose rates, clear data on emerging risks locally in Western Australia. So the motion before us doesn't ask for anything more than that, the consideration of the new data by the government and a report back to Parliament in due course.
It is an important discussion to have, and that would only be brought on by a party like the Legalise Cannabis Party here in WA. We are not afraid to tackle those issues which this government wants to ignore and put in the too hard basket. Supervised injecting facilities aren't a silver bullet, and that needs to be made very clear. This isn't a fix at all, but one tool, and a seemingly very successful one that the data shows has a real impact at saving lives. By having appropriate healthcare services and social support services, we can give those people hope, give them the motivation to give up their addictions, help them see that their life can have value.
The current approach to reducing the harm that illicit drugs cause in our community is clearly not working. And right now, many of the things we are doing to address this issue are making the crisis worse rather than better. For too long, the politics has ignored the research and has left harm reduction approaches under-resourced, restricted us from undertaking innovative trials and putting lives at risk. Staff at the clinic, and this is a really important point, this last one, staff at the clinic were also able to provide more than 13,000 interventions for issues like mental health, housing and family violence, acknowledging that an evidence-based approach that seeks to prevent and minimise harm as the most effective way of managing issues of drugs, whether they're illegal or legal. And on that basis, I'm very happy to support this motion.
Leader of the House.
Thanks, President. Now, while I thank the member for bringing this motion to the House, if it was to go to a vote, the government wouldn't be supporting it. 20 plus years in this place, I have learnt a few things. And one of the things I have learnt is that public policy does not begin when you enter this place. It does not end when you leave it. So you always need to look at history and don't assume that just because you haven't seen something happen in the 2 years that you may have been a member in this place, that it hasn't been debated before, that it hasn't been considered by government before, because it has. The motion before us reflects the Labor Party's policy, which is that drug and alcohol policy should be based on evidence and what works. And there's no dispute about that. Our policies are based on evidence and what works. That's exactly what we're doing. Our policies, our services and our programs are based on evidence and are designed to meet our specific needs. The main driver of the North Richmond safe injecting room in Victoria was a specific local issue about addicts shooting up in the streets. That's what drove it. It was a specific local issue. Now, whether it's a good thing or not, the addicts in Western Australia, the advice from the Mental Health Commission, the Methamphetamine Task Force and others, is that they shoot up at home. The medically supervised injecting room was effective in responding to a localised drug injecting issue in North Richmond, but given the current nature of injecting drug use in Western Australia, the introduction of a similar model here is not warranted. That's looking at the circumstances, that's looking at the evidence here, in front of our eyes now. Our response is indeed evidence-based.
I think there was recently a report that came out around where they do the sewage testing, and it releases who is the meth capital of Australia, who is the heroin capital of Australia, and etc. And that quite visibly shows that each state has different drug problems. They have different approaches to how they do the drug use. So here in Western Australia, more at home. Victoria, very visible, very on the street, and seems that what they did was appropriate for what they were doing. There are other spaces, I think, that are providing that type of success. Now, that work here. That work here already, and that the government is supporting. And I know the state government supports these things because I've seen it.
What we as a government have made our focus on is getting into the space of prevention, early intervention and treatment. Safe injecting rooms may not be, from my perspective, the most effective approach to addressing AOD-related problems in our state. Instead, we've chosen to prioritise prevention and treatment strategies that can have a more significant impact on reducing the harm caused by AOD use in the long term. So, and whilst I say that, I think we can always do more. So more investment in prevention, and that goes for all ranges of healthcare provided to citizens of Western Australia.
But I think if you look at the habits of the users in Western Australia, it certainly wouldn't be the thing you'd go to first. And I think, and I didn't have enough opportunity to look at the other things that this government and previous governments have done, but there are many things that are happening, and obviously it's been determined that those have a greater impact and greater effect than what in the injecting room. So I won't be supporting it, but I'm glad you brought the motion to the House. It is always worthwhile talking about. It is a scourge on society everywhere in the world. So thank you very much for bringing the motion, but I won't be agreeing with it.
And I say from the outset I won't be supporting the motion, but I'm glad he brought the motion to the House. It is a chance for us to talk about something that's important. Western Australia is now experiencing the lowest proportion of illicit drug use since 2001, and I think that is a good thing. Actually tailoring what needs to be done to the individual and making sure that that all through that process the individual is being looked after. And so this is the power of funding going to the right places, from whether it's drug-related issues or homelessness to a stable living environment, then to full-time, ensuring people get into full-time study. It's about putting the money where the money needs to be.
The question is the motion be agreed. The Honourable Peter Foster.
Thank you, Active President. And I also too rise to speak in opposition to the motion moved today by the Honourable Dr Brian Walker. I was disappointed was that we didn't actually talk about any of the services that are being provided already. Well, you didn't acknowledge any of the good work and any of the organisations that are working in this space, and it was really pleasing to hear that members on this side of the House talked about some of the organisations and some of the good work that's happening. It says the government rejected injecting rooms based on the fact that there were safe alternatives. Now, WAC are providing some safe alternatives.
There were quite a lot of submissions about the fact that Western Australia is small, and actually we're quite sprawled out in terms of our area, and that in that respect, you know, is it a practical thing for us to have here? And thank you. I'll leave my comments there.
The time allocated to non-government business having lapsed, that motion lapses, and we move to private members' business.